Vertebral column, also called spine, backbone, spinal column, makes up about 2/5 of your total height. It consists of bones and connective tissues. Please keep in mind, bone is a type of connective tissue. And also I will explain in this video what connective tissues we expect to find in intervertebral discs, those discs that we find between the vertebral bones. In an average size male adult, the height of vertebral column is about 71 centimeters, that equals 28 inches. In an average size female adult, the height of vertebral column is about 61 centimeters, that equals 24 inches. Spinal cord, which is part of the central nervous system, runs through the vertebral column. So in the vertebral column, we have spinal canal, or we can say vertebral canal. That's the location that we're looking for spinal cord. But that's not the only thing that vertebral column does. When I go up, I see skull sits on the first cervical vertebral bone. Recall that C1 also is called atlas, with occipital condyles of occipital bone. Together, they form atlanto-occipital joints. And in this joint, we can move our head up and down. When I move down, I see that vertebral column also is articulating with the pelvic girdle, with the two hip bones. In the thoracic region, when we look at the skeleton, we see that vertebral columns are attachment points for our ribs. Please keep in mind, we have 12 bones in the thoracic region of the vertebral column, and we have 12 pairs of ribs. Also, vertebral column would be the attachment site for muscles of back and upper limbs. In general, during early development, when we count the number of vertebral bones, we have 33 bones. However, later, some of these bones fuse together. So when we count the number of vertebral bones in an adult around age 30, we notice that we have only 26 bones. When we look at the vertebral column from anterior view, or if I change the view to the posterior, you would see that vertebral column in a healthy individual is straight. However, the moment that we look at the lateral view, we must notice some slight bends. We call them normal curves that we have in vertebral column. And we're looking for 4 of these curves. We have a curve in the cervical region. We name that cervical curve. The next curve would be in thoracic curve. Then we get to the lumbar curve. And the 4th curve would be in sacrum. So that's sacral curve. The thoracic curve and sacral curve are referred to as primary curves because they retain the original curvature of the embryonic vertebral column. If you look at the shape of an embryo clearly, you notice the curve in the vertebral column of an embryo. Cervical and lumbar curves are secondary curves because they begin to form later, several months after birth. But in general, by age 10, all curves are fully developed. Over time, when we get older, some changes happen to these curves. For example, the secondary curves, cervical and lumbar, may be progressively lost in old ages. So it's important to note the age of the individual when we are analyzing the vertebral column of that person. Why we need these curves? First of all, they absorb shock during walking, or in general any body movement that we have, that we move our entire body from point A to point B. They help protecting the vertebral column from fracture. This is a general rule. When we look at the anatomy of even long bones, like the bones that you have in your limbs, you see that even long bones have some curves that helps the bones to be protected from fracturing easily. Also, these 4 curves that we have in vertebral column, they increase the strength of the vertebral column. They help maintaining balance when we are in an upright position. So these are some of the benefits of having these 4 curves. And as I mentioned, 2 of them are primary curves. We retain them from the time that we were embryos. And 2 of them are secondary curves. They form after birth. Now it is time to focus on these intervertebral discs. The discs account for 25% of the height of the vertebral column. Each disc has an outer fibrous ring consisting of fibrous cartilage. We call the outer ring of the disc annulus fibrosus, but the inner side of the disc is soft, pulpy, highly elastic, and we call the inner part of the disc nucleus pulposus. So fibrocartilage is the outer part, and the inner part would be mostly elastic substance. The superior and inferior surfaces of the discs consist of a very thin plate of hyaline cartilage, and as you notice, on the superior and inferior surface, these intervertebral discs are connected to the vertebral bones. Basically, they're articulating two vertebral bones together. During the course of a day, the discs compress and we lose some water from the cartilages that we have in the disc. So we are a bit shorter at night, but while sleeping, there is less compression on the vertebral column and the intervertebral discs, and rehydration of the cartilages happen, so we are taller when we wake up in the morning. But we know that over time, changes happen to the intervertebral disc. The most important change would be to the inner part, nucleus pulposus. The inner part that used to be elastic, cushiony, becomes less elastic, becomes more rigid. We know that when we get older, we lose a small percentage of our height. Let's make it clear that decrease in vertebral height with age results from bone loss in the vertebral bodies. And when we say vertebral bodies, we are talking about the bulky anterior part of the vertebral bones, exactly the part of the vertebral bones that are connected together by intervertebral discs. So in short, losing our height when getting older is mostly due to bone loss. Now I walk you through different sections of these 26 bones that we find in an adult. I start with the cervical portion. In the cervical portion, we should find 7 cervical vertebral bones. So that's C1, C2, C3, C4, C5, C6, and C7. C1 also is referred to as atlas. So that's the one that articulates with the occipital bone and forms atlanto-occipital joints. C1 and C2 articulate together. C2 also is referred to as axis. Between atlas and axis, we have a joint that is called atlanto-axial joint. In atlanto-axial joints, we move our head to the side, right and left. The rest of the cervical vertebral bones, we just refer to them using the name cervical and the number. And as you can see, when we get to C7, we see that C7 superiorly articulate with C6. Inferiorly, it articulates with T1. Before I move down to the thoracic region, as you can see, we have the vertebral arteries on both sides. Obviously, they are here to supply the structures that we have in this section. And if I look at the lateral, I notice that between the vertebral bones, we have openings. We name these openings intervertebral foramina. And as you see, through each intervertebral foramen, one of the spinal nerves exit. We have 7 cervical vertebral bones, but when I count the number of spinal nerves that exit in this section, I count 8 pairs of spinal nerves. The reason is, when I look for the first pair of spinal nerves, that would be the first pair of spinal nerves, C1, I see that they exit exactly in the openings that we have between occipital bone and atlas. So the spinal nerves that exit between atlas and axis are spinal nerve C2. And then we have C3, C4, C5, C6, C7, and C8. So this is important to note that even though we have only 7 cervical vertebral bones, we have 8 pairs of cervical spinal nerves. Now I go back to the thoracic bones. As I mentioned, we have 12 thoracic bones. When you have an X-ray, one easy way to tell which thoracic bone you're dealing with is to also pay attention to the ribs that we have. Recall we have 12 pairs of ribs. So clearly, if I'm looking at ribs number 5, they're articulating with thoracic bone number 5. The anterior part of these bones would be referred to as body. That's the weight-bearing part of the vertebral bone, and that's exactly the part of the vertebral bone that articulate with the upper and lower vertebral bones by those intervertebral discs. Now, if I go to the lateral side, on each side I can see an extension that is attached to the body. We call that pedicle. So right now I'm pointing at the left pedicle. We have also a right pedicle. And when I move more posteriorly, I have a section that is called lamina. So body is in the anterior, then from body we have the two pedicles, and then the two pedicles posteriorly are connected together by a lamina. And exactly between these structures we have a foramen that is called vertebral foramen. And when these bones articulate together, the vertebral foramina of these bones forms vertebral canal or spinal canal. If I look closely, I can see vertebral canal is the place for spinal cord. So spinal cord runs through the vertebral canal. However, please note that spinal cord is much shorter than the vertebral column of an adult. Later I explain exactly where is the place that we expect spinal cord to end. For now, at least we identified the body, the two pedicles, and the lamina. And then I notice exactly where pedicle and lamina fuse together. We have these two extensions. We call them transverse processes. And exactly posteriorly from lamina, we have another process that is called spine or spinous process. So if I look at the spinous processes, we can see them on the posterior, and these are all attachment site of some muscles. And please keep in mind that on the transverse processes, we have also, aside from muscles, we have places for articulation of the ribs. I would like you to pay attention to the size of the body. As you see, when we are moving down toward the lumbar region, the size of the body enlarges. The largest body would be obviously found in the lumbar region because most of the weight is on that area. And if you look at the shape of the spinous processes, you see when I move down, they start becoming shorter. When I go up to the cervical region, all the cervical bones do have spinous process except atlas. So atlas does not have a spinous process, which I'm sure it is clear why. Without a spinous process, occipital bone, basically our skull, can move backward easily. So if you had a spinous process in atlas, that would interfere with the backward movement of the skull, which we call that movement hyperextension. So now again, I go back to the thoracic region and I see that T12 articulate superiorly with T11, inferiorly it articulate with L1, and laterally, let's not forget, it articulate with ribs number 12. Those are the last ribs that we have. Then I get to lumbar bones. We have 5 lumbar bones. Somewhere between L1 and L2, we have the end of the spinal cord. So below that, when we go inside the vertebral canal, we find spinal nerves. We don't have the actual spinal cord, and that explains when we have a lumbar puncture to not damage the central nervous system, why we attempt to extract cerebrospinal fluid, for example, somewhere between L3 and L4. We are far away from spinal cord, so there is no risk of damaging the actual spinal cord, but we are still in a place that we can extract some cerebrospinal fluid as a sample for examination. Or if we need to do an injection, again, that would be a good place to do a lumbar injection. I move down to lumbar number 5, and I see lumbar number 5 inferiorly articulate with the bone sacrum. Sacrum is the result of fusion of 5 sacral bones. Usually between ages 16 to 18, fusion of these bones together starts, and this process completes by age 30. So when we reach age 30, we have just one sacrum. And it is important to note, I go to the posterior view so you can see it, that the story of coccyx is very similar. Coccyx is a bone that is the result of fusion of 4 coccygeal bones. And fusion of those bones to form one coccyx usually happens between ages 20 and 30. Now I go back to the anterior view. I see that sacrum is the bone that superiorly articulates with L5. Laterally it articulates with the 2 hip bones, and inferiorly it articulates with coccyx. So sacrum articulates with 4 other bones, and I see exactly those foramina that we have between those 5 sacral bones that we used to have. We name these foramina sacral foramina, but it's interesting, if you are pointing at them and analyzing them in anterior view, you must say anterior sacral foramina when you're talking about the exact same foramina, but on posterior view, you refer to them as posterior sacral foramina. So we have 4 pairs of sacral foramina on anterior and also on the posterior side. The part of the sacrum that articulates with L5 is called base of the sacrum. Again, I have to go back. The pointy part of the sacrum down here that articulates with coccyx is called apex of the sacrum. So base is up here and apex is down there. The lateral side of sacrum, the part that articulates with the 2 hip bones, we refer to them as sacral ala. And even though in this model we don't see them easily, but in a real sacrum, exactly the place that sacral bones fuse together, we should see a line. We call the lines transverse lines, and we see them in the anterior view. Now, if I go back to the posterior view, this irregular rough edge is the result of fusion of the spinous processes of those 5 sacral bones. We call this median sacral crest. And then at the end we have an indentation that is called sacral hiatus. So these are some important anatomical landmarks that we can identify in sacrum. Since we have the hip bones in this model, it's a good idea to quickly go through the anatomy of the hip bones also. Hip bone is a bone that is the result of fusion of 3 bones. The upper bone is called ilium, and the 2 lower bones, the one that is on the anterior, we call it pubis. The one that is on the posterior, we call that ischium or ischium. So ilium, ischium, pubis. As you can see, all 3 bones together form a round depression. That depression is called acetabulum. This is exactly the place that the round head of femur articulate with to form hip joint. And we have obviously 2 hip joints. Between ischium and pubis, we have a large opening, which is a very important pathway for many structures such as blood vessels, lymphatic vessels, and nerves to move from pelvic cavity into the lower limb. We call this opening obturator foramen. When we analyze ilium, the upper part of ilium that looks like a wing is called iliac ala. The bulky part of ilium is called body of the ilium. So that's part of the body of ilium that forms the superior section of acetabulum. And then I notice in ilium, when I look at the anterior view, I have 2 elevations. We call these 2 elevations iliac spines. Since they are on the anterior side, we say anterior iliac spines. To differentiate the anterior iliac spines, we say that's anterior superior iliac spine. This is anterior inferior iliac spine. Now, if I go to the posterior view, in the posterior view of ilium, we find 2 iliac spines. Obviously, we name these 2 posterior iliac spines. That would be posterior superior iliac spine. This is posterior inferior iliac spine. And right here I can see a very large indentation. This is called greater sciatic notch. Clearly we name it greater sciatic notch because a nerve such as sciatic nerve passes through this area. The rough area that we have up here is called iliac crest. And iliac crest, for example, would be the attachment point for some very important muscles. Now, when we get to ischium, recall it's the lower bone on the posterior side. One thing that I noticed would be that ischium has only one spine, so we call that ischial spine. Below ischial spine, we have a small depression. We call this lesser sciatic notch. So greater sciatic notch is in ilium, lesser sciatic notch is in ischium. And then we see ischium has a rough area. That's exactly the place that meets the chair when we are sitting. We call this ischial tuberosity. And the part of ischium that extends to fuse to pubis is called ischial ramus. Then I get to pubis. Pubis is the anterior bone. It has two rami. The superior ramus fuses to ilium. The inferior ramus fuses to ischial ramus. And then exactly in the anterior, pubis, one side, articulate with the pubis in the other side. So the two bones articulate together with a fibrous cartilage layer, and we name this joint pubic symphysis. And when we analyze exactly the surface of pubis, the surface that the fibrocartilage is attached to, we see that that surface is rough. Clearly, having a rough, bony surface allows these connective tissues to hold on together and attach together more firmly. One main reason that the two hip bones should not be fused together, instead we need to have a joint, pubic symphysis, is because that sometimes we need to get help from the flexibility of this joint. For example, when we are walking, having a joint here instead of just solid bone allows some flexibility. The next thing is we know inside the pelvic cavity we have some organs that sometimes they need extra room. For example, urinary bladder for several hours should hold on to urine. Or in female, we have uterus here, which any changes in the uterus that causes enlargement of the uterus, which happens during menstruation or during pregnancy, requires pubic symphysis to provide that flexibility. And it's interesting that in female, the ovaries release a hormone named relaxin that actually adds to the flexibility of the pubic symphysis, which is absolutely necessary when the female is ready for pregnancy or when the female actually becomes pregnant. And the pointy part that we have right here in each one of these two bones would be called pubic tubercle. This was a short summary of the vertebral bones and also the hip bones. I hope that you find this information helpful.